Many people think type 2 diabetes simply means having high blood sugar. But the real problem often starts years before blood sugar becomes dangerously high. The body's cells gradually stop responding properly to insulin, forcing the pancreas to work harder and harder until it can no longer keep up. So how does this happen? Type 2 diabetes is a condition in which the body cannot use insulin effectively, a problem known as insulin resistance. Over time, the pancreas may also struggle to produce enough insulin, causing blood sugar levels to remain higher than normal. Normally, after you eat, carbohydrates are broken down into glucose, which enters the bloodstream. The pancreas releases insulin, allowing glucose to move into the body's cells where it is used to produce energy. In type 2 diabetes, the body's cells become less sensitive to insulin. It's as if the key still fits the lock, but the lock has become difficult to open. To overcome this, the pancreas produces more insulin. For many years, this extra insulin can keep blood sugar under control. However, as insulin resistance continues, the pancreas becomes overworked. Eventually, it can no longer produce enough insulin to meet the body's needs. Blood sugar then begins to rise and remains elevated, increasing the risk of long-term complications. Several factors increase the risk of developing type 2 diabetes. These include being overweight, physical inactivity, family history, older age, high blood pressure, and certain ethnic backgrounds. However, even people who are not overweight can develop the condition. Symptoms often develop slowly and may go unnoticed for years. Common symptoms include increased thirst, frequent urination, constant tiredness, blurred vision, slow wound healing, frequent infections, and numbness or tingling in the hands and feet. If blood sugar remains high for many years, it can damage blood vessels, nerves, the eyes, kidneys, and the heart, increasing the risk of serious health problems. The understanding of type 2 diabetes has improved greatly through research into metabolism, insulin resistance, genetics, and lifestyle factors. This has led to better treatments and earlier diagnosis. Treatment usually begins with healthy eating, regular physical activity, weight management, and medications that improve blood sugar control. Some people eventually require insulin if the pancreas can no longer produce enough on its own. Today, artificial intelligence is making diabetes management more personalized. AI can analyze data from continuous glucose monitors, smartwatches, fitness trackers, meal logs, and insulin records to predict blood sugar changes throughout the day. It can recommend adjustments to meals, exercise, or medication and help doctors identify patients who are at higher risk of complications. Researchers are also using AI to detect early signs of type 2 diabetes from routine health records, allowing treatment to begin before serious damage occurs. Type 2 diabetes is a condition that develops when the body becomes resistant to insulin and can no longer keep blood sugar under control. Understanding how it develops shows why healthy lifestyle choices, early diagnosis, and modern technologies play such an important role in preventing complications. Now that we've explored both major types of diabetes, in our next video we'll look at hypoglycemia explained and discover what happens when blood sugar falls too low instead of becoming too high.